Good morning, good afternoon, good evening, whatever time that you'll be watching this video. Greetings to you and thank you so much for making time and tuning in. So on today's video, I will be presenting about the cardiovascular system, but of course focusing on a few objectives on the cardiovascular system. Alright, so the first objective is the pathway of oxygenated and deoxygenated blood. The second objective is the different components of blood, and lastly, blood diseases. I also believe that before I delve into explaining all these objectives, it's very important to note or for you to take note of the keywords such as deoxygenated blood, which is blood that has a low supply in oxygen, oxygenated blood, which has more supply of oxygen, and systole and diastole. Systole is a phase of contraction, then diastole is a phase of relaxation. And then the valves are structures that prevent the backflow of blood. And then for inferior and superior, this one is just to help you understand the directional terms. So for instance, I'm going to talk about the inferior and the superior vena cava, of which the superior is above and then the inferior is below at the bottom. In order to understand the cardiovascular system, it is also important to understand what makes up the cardiovascular system. So cardio means the heart and vascular means blood vessels, which then makes sense when we say that the heart and the blood vessels make up the cardiovascular system. So the heart's role there is to pump blood, and the blood vessels such as the arteries, the veins, and the blood capillaries carry blood from the heart to the body, or from the body to the heart to the lungs. We will touch more on that as the presentation goes on. As you can see, the diagram on the left, on my left, is a diagram showing the structure of the heart. There is one key thing that I want you to note when it comes to this one. So I'll use myself as an example. I'm here. I'm facing the picture, the diagram of the heart on this presentation. I'm going to imagine that as someone who is right in front of me. Their left atrium is my right atrium. Their right atrium is my left atrium. The same goes for the ventricles. Their left ventricle is my right ventricle, and their right ventricle is my left ventricle. And that sums up the fact that the heart is a four-chambered muscular organ. Four-chambered. Why am I saying this? I already mentioned the chambers. So the heart has four chambers, as I mentioned. Two top chambers, which are the left and the right atria, and then two lower chambers, which are the left and right ventricle. There's also a structure known as the septum, which divides the heart into left and right sides. But just to also be specific for this one, for the septum, there is the interatrial septum, which divides the heart into the left and the right atria, and then there's the interventricular septum, which divides the left and the right ventricle, as the name states. And then there are also four valves: the tricuspid valve, the bicuspid valve, the aortic semilunar valve, and the pulmonary semilunar. So for the positions of these valves, the tricuspid valve, when you look closely into the diagram of the heart, you can see that it is between the right atrium and the right ventricle. Then we have the bicuspid valve, also known as the mitral valve. It is between the left atrium and the left atrium and the left ventricle. Then there's the aortic semilunar valve. it is between the left ventricle and the ascending aorta. Then lastly, the pulmonary semilunar valve, as we can see in the diagram again, it's between this is the right ventricle. Yes, it's between the right ventricle and the pulmonary trunk. As mentioned in the presentation before, that the blood vessels also make up the cardiovascular system. These are the arteries, the veins, the capillaries. So arteries carry oxygenated blood away from the heart. An example is the aorta. Exception here would be the pulmonary artery. The pulmonary artery carries deoxygenated blood from the heart to the lungs. The arteries have thick muscles, therefore a smaller lumen, so that they can handle pressure from the heart and not burst. Then the veins, they carry deoxygenated blood to the heart. An example is the inferior and the superior vena cava. So the exception for the veins would be the pulmonary vein, because these carry oxygenated blood from the lungs back to the heart. So veins have thinner muscles compared to the arteries, and therefore they have a large lumen, as you can see on the diagram on my left. They also have valves. Veins also have valves. Then lastly, the other blood vessels are what we call the capillaries. They carry blood between the arterial vessels. Arterial vessels are vessels that carry blood away from the heart. And then the venule vessels, these are vessels that carry blood towards the heart or to the heart. So the role or the function of capillaries is just to exchange material between blood and tissue cells. The pathway of blood is simply about the route that blood takes. So for this one, firstly we would have what we call the pulmonary circuit. This is the circulation of blood from the heart to the lungs and back to the heart. It happens through the pulmonary artery and pulmonary vein. There are other structures that are involved in the circuit, such as the right ventricle, the pulmonary trunk, and the capillary network in the lungs. There's also what you call the systemic circuit, which is a circulation of blood to and from all other body tissues. Some of the structures that are involved in this one are the arteries, the veins, the capillaries, the left ventricle, and the right atrium. Then there's what we call the fetal circulation. This one is it is for the fetus. So this one is a bit different from pulmonary and systemic circuit, because for the fetus does not have lungs. But for the pulmonary circuit and the systemic circuit, you find that the lungs are involved, and these two work hand in hand. So for the fetal circulation, the placenta provides oxygen and nutrients for the fetus through the umbilical vein, which carries oxygenated blood, and the umbilical arteries, which carry deoxygenated blood. So now this is the pathway of blood, more expanded now for you to understand it. So the picture on my left is a picture that shows normal heart blood flow. So just to give you a key, the blue color there represents deoxygenated blood, and the red color represents the oxygenated blood. I'll be using some abbreviations, but as I use those abbreviations, such as RA, RB, I will say them in full as well. So what happens first is this. The right atrium, RA, it receives deoxygenated blood through the superior and inferior vena cavas from the body. So now at this stage, we find that blood that is deoxygenated is coming from the body to the heart. So on step 2 then, the right atrium, it contracts, and this is known as atrial systole. Recall that systole is a phase of contraction. So the right atrium contracts and pumps deoxygenated blood to the right ventricle through the tricuspid valve, which will open. But then after all the blood is transferred into the right ventricle, the right atrium, not the right atrium, but rather the tricuspid valve would close to prevent the backflow of blood. What happens next is then what we see on step 3, the artery, which is the right ventricle, then contracts to push blood into the pulmonary trunk through the pulmonary semilunar valve, then out to the lungs through the pulmonary artery to gain oxygen from the lungs. At this point now in the lungs, so what happens is the blood now becomes oxygenated, right? So after it is oxygenated or gains more supply of oxygen, the pulmonary vein would then be the carrier of this oxygenated blood through the left atrium. Now the blood is coming from the lungs back to the heart through the pulmonary veins, through the left atrium, which will receive this oxygenated blood as we can see there. Then step 5, the left atrium pumps the oxygenated blood through the mitral valve, which is also known as the bicuspid valve, to the left ventricle. Then step 6, the aortic semilunar valve opens, and this oxygenated blood from the left ventricle is pumped out to the rest of the body through another artery known as the aorta. Then the cycle or the path repeats again, because now that the blood goes to the rest of the body through the aorta, it's oxygenated. Then when it gets deoxygenated, it has low supply of oxygen, it comes back via the superior and inferior vena cava, as I explained on step 1. The blood. When you prick your finger, when a blood sample is being collected from you by a medical laboratory scientist, what we then see is a red liquid, and that is blood. So blood is a liquid that moves through vessels in the cardiovascular system. It delivers essential or vital materials to parts of the body like organs and also the cells. And the blood is made up of the following components: plasma, red blood cells, white blood cells, and the platelets. As I just mentioned, one of the components of blood is the plasma. So plasma is the liquid portion of the blood. So when you centrifuge blood with the intention to separate its contents, what then settles at the top part, as we can see on the diagram on the presentation, is the plasma. The yellow part is the plasma, and the serum would then be the fluid that is found in the plasma. Then what settles at the bottom is the white blood cells, the platelets, and the red blood cells, forming white and red layers. One other component of blood is the red blood cells. Red blood cells have a biconcave shape. This biconcave shape, it increases surface area for exchange of gases. Red blood cells, also known as erythrocytes, they have no nucleus, or they lack a nucleus. Lacking a nucleus would then create space for hemoglobin, which is needed for transport of oxygen. One other thing about RBCs is that they are made in the bone marrow, and their function is just to carry oxygen to body cells and carbon dioxide to the lungs. And the diagram there shows us where we then see hemoglobin, as I was mentioning that a lack of a nucleus will create space for hemoglobin and the bioconcave shape, which will then increase the surface area for gas exchange. Next up are the white blood cells. These defend the body against disease and infection. They are also produced in the bone marrow. They have a nucleus and a mitochondria. So for the white blood cells, they have two main divisions or two main groups. They divide into two main groups, which are the granulocytes and the agranulocytes. So these are differentiated on the basis of granules. The granulocytes have granules in their cytoplasm. Cytoplasm is the jelly-like structure that we see there. And then the agranulocytes, they do not have granules, and as we can see in the diagram, it's just clear. So the granulocytes are the neutrophil, the eosinophil, the basophil, and the agranulocytes would be the monocytes and the lymphocytes. Also, white blood cells are known as the leukocytes, and the diagram there just shows us the divisions of the white blood cells. The main role function of the white blood cells is to fight against any invaders, any infections, any diseases that try to harm the body, and that is the function that links all the white blood cells together. I just mentioned a few, there's more, but I just focused on a few white blood cells. So under the granulocytes, we have the neutrophil, which attacks pathogens that try to invade the body. We have the eosinophil, which fights the body against any infections and increases inflammation. We have the basophil, which cleans up toxins and releases compounds like histamine, which produce immune responses. Under the granulocytes, we have the monocyte, which turns into macrophage when bacteria invades the body. And lastly, the lymphocyte, which is divided into two cells, which are the T lymphocytes, known as the T cells, and the B lymphocytes, known as the B cells. So the T lymphocytes just kill the infected cells, and the B lymphocytes, or the B cells, produce antibodies. The other component of blood are the platelets, which are also known as the thrombocytes. They are responsible for blood clotting. Simply put, they prevent excessive bleeding. But how do they do this? Through the clotting process. Firstly, the blood vessels narrows to prevent more blood leakage. Secondly, platelets are released into the blood to travel to that injured site. Then 3, the platelets change shape and become sticky and stick together. And then 4, the closing factors like fibrin are released to form a mesh which traps RBC to form a blood clot, hence preventing excessive bleeding. Lastly, there are diseases that are related to blood. Firstly, we have what we call the paroxysmal nocturnal hemoglobin, also known as PNH. This is a disease that affects the immune system. Some of the symptoms of this disease are the following: difficulty in swallowing, blood clots on unusual sides, the legs, and so on, chronic fatigue, and lastly, dark urine in the morning. Another blood disease is what we call the thrombocythemia. This is a disease in which your bone marrow makes too many platelets. Having too many platelets makes it hard for your blood to clot normally. Some of the symptoms of this disease are bloody stools, bleeding after injury or surgery, weakness, headache and dizziness, and swollen lymph nodes. So, in a nutshell, it is very important that with any slightest change in our bodies, or any slightest change that we experience in our bodies, should just visit the doctor just to be sure and just to be safe, because early diagnosis is much better. Thank you for listening.